Welcome to healthU. Sitting at your desk for more than 9 hours a day, do you know that your spine is bearing 90% more pressure than when standing? Today we're going to delve into the most overlooked health crisis in modern society. Have you ever wondered why you often feel back pain even though you don't do heavy work? The answer lies in your daily sitting posture. According to the latest medical research from 2024, modern people sit for an average of more than 12 hours per day, and this number hides alarming health risks. Let's start with the data. Up to 37% of people sit for more than 6 hours per day, and many office workers sit for more than 9 hours daily. When we add commuting, dining, entertainment, and other times, the sitting time in a day often exceeds 12 hours. Medically, prolonged sitting is defined as low metabolic activities for more than 9 hours during waking hours, or continuous sitting for more than 40 minutes at a time. This seemingly simple behavior is having a profound impact on our spinal health. From a biomechanical perspective, the impact of sitting posture on the spine is far more serious than we imagine. The latest biomechanical research in 2024 found a shocking fact. The pressure on intervertebral discs in sitting position increases by 40 to 90% compared to standing. When we transition from standing to sitting, lumbar lordosis decreases and the pelvis tilts backward. This postural change causes a sudden increase in pressure on the front of the intervertebral disc, and the tensile stress on the back also increases accordingly. Even more concerning is that normal lumbar spine has a natural lordotic curve that helps distribute weight and absorb shock. However, prolonged sitting will gradually straighten this important curve or even cause it to bend in reverse, leading to abnormal alignment of facet joints and greatly increasing the risk of degenerative changes. There's another common problem in modern office environments: forward head posture. You might not know that when the head tilts forward 45 degrees, the pressure on the cervical spine increases dramatically from the normal 5 kilograms to 22 kilograms, equivalent to hanging 4 bowling balls on your neck. No wonder cervical spondylosis is becoming increasingly younger. The effects of prolonged sitting on the human body are by no means limited to the spine. It causes weakening of core muscles, especially deep abdominal and back muscles. The weakening of these muscles causes the spine to lose adequate dynamic support, increasing the risk of intervertebral disc herniation, scoliosis, and other diseases. More seriously, a 2024 study in the Journal of the American Cancer Society showed that sitting for more than 6 hours per day increases the risk of 12 chronic diseases, including cardiovascular disease, diabetes, and even certain cancers. The study found that women's risk of breast cancer increased by 10% and colorectal cancer risk increased by 12%. Intervertebral disc herniation and nerve root compression can lead to neurological symptoms such as sciatica and lower limb numbness. Long-term nerve compression not only affects local function, but may also affect overall nerve conduction efficiency, creating a chain reaction. However, we are not helpless against this. Scientific research in 2024 provides us with effective prevention strategies. First is workplace environment improvement. The Stand and Move at Work research project found that multi-level workplace interventions using sit-stand workstations can continuously reduce employees' sitting time over 24 months, reducing upper back and neck pain by 54%. This data tells us that changing the work environment can indeed bring real health benefits. Exercise compensation strategies are equally important. Research in the British Medical Journal confirmed that more than 22 minutes of moderate to vigorous physical activity per day can reduce mortality risk by 15% to 35%. More specifically, replacing 1 hour of sitting with vigorous exercise daily will reduce the risk of diabetes, chronic kidney disease, and other diseases by 7% to 19%. Technology also brings us innovative solutions. Research published in 2024 evaluated the effectiveness of the wearable robot BotFit for posture correction. This smart device can monitor and correct poor posture in real time, significantly increasing rectus abdominis tension, reducing trapezius muscle tension, and improving spinal angles. So what should we do specifically? First, adopt dynamic sitting strategies. Remember the 390-degree rule. Keep knee joints, hip joints, and elbow joints all at 90 degrees. At the same time, get up and move for 2 to 3 minutes every 30 minutes, performing simple stretches of the neck, waist, and legs. This small change can bring huge health benefits. Choosing the right support system is also crucial. Choose a chair with good lumbar support to ensure adequate lordotic support for the lower back. The chair height should allow feet to be flat on the floor with thighs parallel to the ground. If your existing chair is not ideal, you can use a lumbar cushion to provide additional support. Adopting the concept of micro-exercise is very practical. Use fragmented time for spinal health exercises. Research shows that 5 minutes of spinal activity per hour can effectively combat the negative effects of prolonged sitting. These micro-exercises include shoulder rotations, neck stretches, waist twists, and other simple movements. In terms of clinical treatment, there have also been important advances in 2024 research. Dynamic lumbar extension, combined with transverse abdominis contraction techniques, can maintain deep trunk muscle activity during prolonged sitting and effectively prevent low back pain problems. For sedentary populations, medical experts have developed individualized rehabilitation exercise prescriptions, including multi-dimensional interventions such as spinal stability training, core muscle strengthening, and flexibility improvement. For patients who already have spine-related pain, multimodal pain management is adopted, combining comprehensive treatment plans including physical therapy, exercise therapy, and lifestyle adjustments. Looking to the future, intelligent monitoring technology will provide us with more precise health management. There will be more smart wearable devices that can monitor posture in real time and provide personalized health advice and exercise reminders. Work environments will also undergo innovation. Office design will pay more attention to dynamic work environments, combining diversified work modes such as standing desks, walking meetings, and exercise break areas. This is not just a trend, but a responsible attitude towards employee health. Integration of preventive medicine is also an important direction. Incorporating spine health issues related to prolonged sitting into the preventive medicine system and establishing a whole life cycle spinal health management plan from children to the elderly. In summary, the impact of prolonged sitting on spinal health is a multifaceted systemic health problem. But through scientific prevention strategies, appropriate exercise interventions, and reasonable work environment design, we can effectively reduce the health risks by prolonged sitting. The important thing is to establish correct health awareness. Don't wait for pain to appear before paying attention to spinal health. Integrate spinal care into daily life and achieve a healthy lifestyle that combines movement and stillness. Modern technology provides us with more solutions, but the key lies in personal health awareness and behavioral change. Everyone should be the first person responsible for their own spinal health, taking proactive preventive measures rather than waiting for problems to appear before seeking treatment. Remember, your spinal health is in your own hands. Starting today, starting with changing your sitting posture, take responsibility for your spinal health. Let's stay away from the dangers of prolonged sitting together and embrace a healthier lifestyle.